HIPcast is brought to you by Enterprise Social Record.
Well, today we have something a little unique. Our HIPcast show has historically been about health information professionals, what they face in daily operations, revenue cycle, CDI, release of information, health policy, AHIMA updates, candidates who are running for things, kind of open forum for AHIMA members to talk. But today we are going to kind of pursue a patient advocacy conversation with Miss Lorie Mills. We will probably refer to her inappropriately as Mississippi just because that's the nickname that we've given her. But
I'm glad you continued that sentence of inappropriately Mississippi, because if you just stopped inappropriately, well, that could also apply to this conversation.
Yeah. So the point of today is Lorie is an expert in revenue cycle, and Lorie has also been doing education for Medicare versus Medicare Advantage plans and kind of what the differences are. And so today we're going to talk about what is a Medicare Advantage plan, what's the difference in Medicare and Medicare, traditional Medicare and those Advantage plans, and then what's included in wellness benefits for those. And we will do a little bit of an introduction for Lorie because our hope is that any of our HIM members who watch this would take this episode and share it out with their family members and their communities, because as we roll into this is going to be posting in August. And that's very close to open enrollment time. You'll probably start seeing some Medicare, enroll in Medicare commercials around that time. Open enrollment will start in October. And so this is kind of something we're hoping that you all will share out with just people that are patients that interact with the healthcare system but aren't necessarily health information professionals. So today's a little bit different. And I'll tell you that Lorie Mills is a tenured, stellar health information professional. She's from Mississippi, as you will hear in her incredible, lovely Southern accent. She has become a national leader in revenue cycle management, and that simply means how healthcare gets delivered, how we document that it was done, how we bill that claim to the health insurance companies, and then how that gets paid or not paid back to the healthcare providers. But Lorie has also been educating folks on Medicare. And so we're going to include in the social media post for this a link to some information that you can get in contact with Lorie. She is available to come and do training for your communities, for your hospitals. And Lorie, I'll let you go ahead. I'll let you at the end, if you'll tell us where all you're doing that kind of education, that would be great. But for us, thank you for the show, for coming to the show. Thank you for joining us again. We love having you on. You're always so full of important knowledge. Today's being a little different though, so thanks for coming back.
Yeah, it's great to be here. Thank you, Shannon and Seth, for inviting me. And I want to start out by just a disclaimer. So what I am doing is not about telling patients they need to take traditional Medicare or they need to take a Medicare Advantage plan. My objective of this education is to inform patients what is the difference between the plans and how to pick the best plan that suits their healthcare needs. As a provider, I do have my preference, but it's not for me to say, you need to do this or you need to do that. You have to do, or the patient has to do what is best for their healthcare needs, not anything to do with me or my entities that I work for. So that's really why we started doing this. And the way I started out with this is my church family. The senior citizens at our church were asking me questions because they knew I worked in healthcare. They were asking me questions about, Humana's called me, or United Health's called me, or I've got traditional Medicare, or I need a drug plan, or I've got to find a supplement. And it's all very confusing, especially for our seniors sometimes. And so I started answering these questions. So I said, well, why don't I just do a presentation to our senior group and then answer questions all at one time, because somebody may ask something that someone else is wanting to know the answer to. So I did that. And then at an organization I'm at right now, that I had talked to them about it. And so they hosted a day to where we did a couple of sessions for seniors to come in and listen to the presentation and ask questions. So it's been very helpful for our patients and our community leaders to get this information and find out really what it's all about.
Absolutely.
Yeah, it's incredibly valuable because I'm sitting here
So good.
thinking, I have no idea. Like, I got the prep document and I've looked at the questions and I'm thinking I couldn't explain this. And I've got a mother that, you know, is on Medicare, and if she asked me the question, I'm like, well, I don't really know. I'm more from the
Right.
health IT side of the world, so this
Mhm.
is good education for those that are out in the community, but it's also good education for me as I help take care of those in my family that are
Mhm.
getting to that point or are past that point in life, and they are getting
Right.
these phone calls. They're getting the sales calls saying, "Hey, you need this, you need that,"
Yeah.
and they don't know, right? It's healthcare is
Right.
complicated, and if they could have somebody that they trust, like Mississippi or Lorie Mills, then hey, maybe the next 30 minutes we can put somebody at ease and then give them the tools to start researching a little bit better on their own. But so let's
Right.
start with that. What is the
Okay.
difference between traditional Medicare and Medicare Advantage plans?
Okay. So traditional Medicare is ran and managed by CMS, the Centers for Medicare and Medicaid. Um, it is government insurance, basically. It's
Mhm.
what you are entitled to when you become 65 years old. Medicare Advantage plans are ran by commercial entities such as United Healthcare, Humana, Blue Cross Blue Shield, those kind of payers. They have a managed plan. And so what we see a lot of times, and I've told my dad this, my dad's 88 and he has some health issues. Traditional Medicare seems to be easier if you have a lot of health issues
Mhm.
because you don't have to get prior authorizations for your tests and things that you need done or your surgeries for the most part. Where your commercial Medicare Advantage plans, they require you to have prior authorizations most times before you have services performed. And that's one of the biggest differences between the plans. Um, Traditional Medicare is broken out into Part A and Part B, and Part A is for inpatient stays. Part B is going to be for outpatient services, doctor's office visits, that sort of thing. Well, over the last few years, Medicare has also come up with that seniors need a drug plan.
Mhm.
So those are called Part D plans. So you have Part A, Part B, and Part D if you're on traditional Medicare. That's the three plans that you would need. Um, Medicare Advantage is called a Part C plan, and it encompasses everything under that one plan. You have drug coverage, you have inpatient and outpatient coverage, so you only have that one plan that you have to deal with. Uh, Medicare Advantage plans, they have typically lots of benefits for the members, and in that sometimes they'll pay for gym membership.
Mhm.
It's called Humana's program's called Silver Sneakers, and they'll pay for
Mhm.
gym membership. They will send you cards in the mail, gift cards. Um, Monthly, you may get $100 or $50 grocery allowance. They'll send you a gift card for that you may get, and those are benefits that seniors do look at and they're excited about because they're
Mhm.
getting the benefit on the front end. But on the back end, Medicare Advantage plans, when it comes to selecting the provider that you want to use, you have to have approval or they have to be a member of that plan in order for you to see them. So if you're out of state, you're traveling, you're on vacation, and you have an accident or something and you need to go to the hospital, you have to make sure that that provider and that hospital is covered under your Medicare Advantage plan, that they're in network, basically. If they're not, then you either could not get any of your visit paid, or it's only going to pay at an out of network benefit. So with traditional Medicare, that's not the case. If you can see any doctor in any area on traditional that's credentialed with traditional Medicare, you don't have to have prior approval for that. If you need to go see a specialist, you don't have to have prior approval. Medicare Advantage plans, you do have to have prior approval. So those are just some of the basic differences in traditional and Medicare Advantage. Um, Another thing, if you have traditional Medicare, you also need what we call a supplement plan
Mhm.
or a Medigap plan. You don't have to have it, it's not required, but it does pick up additional cost. It picks up your 20% that traditional Medicare
Mhm.
does not cover, and pays that and pays some on, if you're having a surgery and or you're getting sent to inpatient, you're being admitted to an inpatient, you have a $1,800 deductible with traditional Medicare that starts over every 90 days if
Mhm.
you're going to be admitted to the hospital as an inpatient. That Medicare supplement or the Medigap plan does help pick up and cover that, and then you would not have an out of cost pocket.
So if I
But
were to
the
explain this to my mother, is it she does not need both a traditional Medicare and Medicare Advantage. It would
No,
be one or the other
she can have one or the other.
based on those benefits and the pros and
Hmm.
cons list
Yep.
between
Yep.
the two, right? And then she would decide from there which one is the best. And if you do traditional Medicaid, you've got the option to do a gap type insurance
Hmm.
to help you with the
Yep.
other expenses. Okay, that makes a lot of
That,
sense.
yeah.
Yeah,
And it's, go ahead, Shannon. Sorry.
I was gonna say you brought up a great point about the deductibles and co-insurance. So with Medicare Advantage, you have a every 90 days that hospital deductible. You also have somewhere around $140 outpatient deductible with traditional Medicare every year. So you got to pay up that. I don't know, maybe it's higher than that now. It could be even as much as $200 for your doctor's visits and things like
Right.
that you pay. And then that the additional 20%, if you don't have a Medigap coverage or secondary Medicaid
Hmm.
or something like that, then if a service, if Medicare will pay $80 of a $100 service, then you're going to have to pay that other $20.
Right.
So if you don't have a Medigap, if you have Medicare Advantage, Lorie, I think, does it depend on the plan? How much your deductible is and how
Hmm.
much any kind of co-insurance might be? How's
Yes,
that work?
it does. It depends on the plan. It's treated more like a commercial insurance, typically the kind of insurance that we're accustomed to, that we've had, most of us have had all of our lives. That's the way it works.
Okay.
Um, so you have a responsibility with Medicare Advantage. That's your responsibility, and there's no way to get out of that. I will say Medigap or Medicare supplements, sometimes they can be expensive depending on the patient. I know my dad has had a few health problems, so his Medigap went up to over $400 a month just for
Mm,
his supplement.
mm,
Well, he's a senior on a fixed income.
yep.
So the way we have worked that out, because he can't afford a supplement every
Mhm,
month, is that most providers have a financial assistance program.
mhm.
And so whenever he's had to go to the hospital or he's had to have major surgery, we usually file for financial assistance through the hospital, and he qualifies based on
Yeah.
his income. So that's something that seniors could look at as well. If you're,
Oh, that's
if
good.
you don't qualify for having Medicaid as a secondary payer, but you don't make enough money to really live on, then you can go and ask for those financial assistance policies. And that's why they're there, is so that
Absolutely.
providers can treat patients and them not be left with this huge, huge out of pocket when they can't really afford it.
I'd say a lot of people don't know that they can go to the
Mm-mm.
hospital or to the provider and say, "Hey, I need help." And is that the finance department? What
Hmm.
department would you recommend?
Yeah. Usually the business office
Yeah.
is where you can ask and inquire about that. And most facility, especially, okay, you guys are in Tennessee, I'm in Mississippi. Most of our rural facilities, they have that type of financial assistance programs.
Yeah, that's awesome. I know for my dad, for many years after he turned 62, he was on traditional Medicare. Then later in his 60s, he had to get on a blood pressure medication
Hmm.
and one other thing. And so I started looking at drug plans. So I had traditional Medicare and a drug plan for a while. Then I
Hmm.
moved him to a Medicare Advantage plan that included the drugs, just like you
Hmm.
said. That Medicare Advantage plan had the drugs as part of it. But then he's 85 now. Lorie and I both have aging fathers, and both of us are daddy's girls too, by the way.
Oh yeah.
But my dad now is 85, and his needs are different. So I actually transitioned him back to traditional Medicare
Hmm.
with a drug plan, because, which by the way, I don't think we've mentioned, you can have traditional Medicare and a drug plan, uh, and not have the Medigap, not have that kind of that gap coverage or
Right.
secondary insurance. You could actually have traditional Medicare plus a drug plan and have your drugs covered, which is what we switched him back to. And Lorie, you're right. You can't really recommend, traditional versus Medicare Advantage, because there's some differences in how long-term care is managed. So for
Yes.
nursing homes, my daughter, being a physical therapist in a geriatric facility, said you have got to get him back on traditional Medicare in case he needs long-term care. She
Hmm.
felt like that was better, at least in her setting. Traditional Medicare was better. So there's a lot to know for sure, and you should be working with someone. I'm thankful that I get to be here to help my dad. But Lorie, one thing that I find a lot of our patients confused about, or uncertain about, is I went to the hospital. So since I went to the hospital, doesn't that mean that I was in the hospital? Well, yes, it does mean you're in the hospital, but there's an inpatient status
Hmm.
and there's an outpatient status. Talk
Right.
about the difference to a patient. If I were a patient, how would you explain the difference from a Medicare perspective?
Okay, so when a patient's admitted to the hospital, and in provider terms, admitted means that we're going to make you an inpatient. That's the language we use. Or we would say place you in observation. Um, for a for a Medicare patient, a patient that is inpatient, that means that the doctor has written an order that says you are being admitted as an inpatient. Then you do have a deductible, but everything is covered and paid under this one bundle payment from Medicare.
Okay.
And you would have your responsibility for your 20%, and this would be paid under Part A. So the hospital would get their payment, and you would only be responsible for your deductible and your 20%. If you go in and you're placed in observation, then it's considered outpatient, and it's covered under Part B. Now, there are things that are not payable by Medicare if you're an outpatient, things such as self administered drugs. So,
Mhm.
if you're diabetic and you're taking insulin, that is not covered if you're an inpatient. Any pills that you take by mouth, any kind of ointments or creams that you're given, those are not covered by Medicare if you're in observation status,
Hmm.
because they're all considered self administered.
Mhm.
Some hospitals will, there's different ways that we handle this. Some hospitals will let you take your home meds if you're in observation status. And some hospitals they won't, but then
Yeah.
they help, they adjust things on the backside for the medications, and you may not have to pay for them. It just depends on what the policy is, and how they follow that. Now, absolutely, the care is the same. You may be on the same floor with a bunch of inpatients. You have the same nursing staff. You're getting the same treatments. It's just that providers are paid differently if you're in an outpatient or an observation status. And I will say the payments for observation is much, much less than what we receive
Mm.
as an inpatient. And what we see a lot of times for between observation and inpatient, Medicare Advantage uh, does not like inpatient statuses. They're much more difficult to um, get the patient qualified for an
Mm.
inpatient. So therefore, the patient's responsibility is going to be higher on the backside. Now, traditional Medicare, basically the rule says if you are in the hospital for 2 midnights, then you should be considered an inpatient. And that is the rules that Medicare, traditional Medicare follows. Your Medicare Advantage plans are supposed to be following that rule, but we're finding that it's not necessarily always done that way. They have other requirements that they want the patients to meet before they will make them inpatient.
Yeah, that's interesting how those Medicare Advantage plans, I appreciate earlier you said that the Medicare Advantage plans are ran like a commercial product,
Mhm.
like what we've been used to. Like our employer had a health plan. We signed up to be on that health plan, and we understood these were our benefits, right? And that's
Right.
how the Medicare Advantage plans are kind of ran. Do they get around that to midnight? The regular traditional Medicare, do the Medicare Advantage plans get around that through medical policy or contracting? How does that happen?
A lot of times it's based on clinical criteria.
Okay.
There's clinical criteria. We use interqualing Milliman most of the times, the names of it. So there's different decision trees that you go through. And if the patient has this test done, or the patient's getting this medication, or the patient's having these symptoms, they follow that through, and that will determine, is the patient going to be an inpatient or an observation patient. Sometimes medical policy from the Medicare Advantage plans determine that as well, on not only the criteria, but some of the Medicare Advantage plans have their own criteria for what they consider clinical indicators for a patient in order to have a certain diagnosis. And so we do see that. We do see that it's a little more difficult to get inpatient approved by a Medicare Advantage plan. And Shannon, and what you spoke to, the long-term care or
Mm,
skilled nursing, traditional Medicare does cover better for your skilled nursing care than typically your Medicare Advantage plans allow. It's very difficult to meet that need for rehab or skilled nursing care on those.
Interesting. So I'm going to play the patient
Of
role here
course.
and ask a scenario because our intended audience here is education, right? And be a
Right,
patient
mhm.
right.
advocate.
Hmm.
So let's do two scenarios. Let's do the Advantage scenario and the traditional Medicare scenario. So I'm admitted to the hospital. I go in because I'm having chest pains because I was playing pickleball, and I've got an Advantage plan, and I drank a Red Bull energy drink, which I shouldn't have done. Went out and played pickleball, and then they say, "Hey, we're going to admit you." But they didn't use the term inpatient or observation.
Mm-mm.
So let's say scenario one, I'm on an Advantage plan. As a patient, what do I need to do, or my advocate, whether it's my family member, a spouse, or a child,
That's
or
a good
whatnot,
question.
a family
Hmm.
advocate? What questions should they ask the facility to help me not get into a bad scenario? And then we'll do the same scenario for traditional Medicare.
That's still good, Seth.
Yeah, the first off, I can go ahead and tell you, you're going to be an observation patient if you come in with chest pain. That pretty well much is your standard observation diagnosis. Everybody comes in because they're going to watch you to see if you're going to, need any further intervention. Um, that would be the first question I ask. I would say, you're admitting me, but am I being admitted as an inpatient, or am I being put in observation? That is
Mm.
the first question you need to ask to have an understanding of what's going on.
And that would tell you, if you're an Advantage person, you would be like, well, I should be at an in-network facility.
Right.
Hmm.
And that would tell me, if I'm an observation, then it's probably going to be a lot easier for the insurance to pay. But if they say you're an inpatient, well, I'm going to say, well, I need certification, or not pre-certifications, and I need some extra help here to make sure that medical necessity is met. Is that correct?
So your Medicare Advantage plan is going to require the authorization, the prior authorization. So what typically happens once you're placed in the hospital, the utilization review committee or employees or case management will review your case. They'll look at it and apply the clinical criteria. If you meet the clinical criteria and the doctor did not put you an inpatient, you were an observation patient, a lot of times they will contact the physician and ask them to change the order to inpatient, and vice versa. If they admit you as an inpatient and you don't meet the clinical criteria, they will call the physician and have them change you to an observation patient.
That's really good information. Now, what's the scenario for traditional in that same situation? Is there a difference? Because I guess you don't have to do the pre-cert for traditional.
Right. The main difference is going to be if you're there for 24 hours, you're probably, a lot of times they will make you an observation patient with traditional, just depending on what's going on with the scenario. Chest pain, you come in. But now, if you're there with chest pain and you come in and they've got you as observation, and then say you start having some more severe symptoms or you have to start having some medication, they have to take you to the cath lab, things like that. Maybe you've turned, then they would make you an inpatient. If you're in the hospital more than 2 midnights, they will make you an inpatient.
From a patient's perspective, Lorie, if I'm in there on a Med Advantage plan and I'm in the ER, and they say they're going to put me in the hospital, they don't tell me if it's inpatient or admission, back to what Seth was saying. Is it better for me as the patient, if I'm the Medicare patient in that situation or my advocate, is it better for me to want to be in observation, or is it better for me in terms of out of pocket? Is it better for me as a Medicare Advantage patient? Do I want to be observation or do I want to be inpatient because of deductible?
You want to be inpatient because for deductible reasons, but also because your meds, your self-administered meds are not covered. And so you think about how many seniors go in the hospital and some of them take 20, 25 pills a day. Well, if it's a pill, it's not covered. And so they're having to pay out of pocket for all of that. So a good reference that seniors every year, Medicare mails out a book. It's called Medicare and You. And you should get that about around the time for open enrollment. Or you can go on to the web and you can search for Medicare and You, and you can pull up a PDF of that book and read through there. And it tells you everything about Medicare and Medicare Advantage plans, what they cover, what they don't cover, your deductibles, drug plans, requirements, things like that.
It seems so counterintuitive for the patient to pay more in an observation status, which is an outpatient status. It seems so counterintuitive to pay more as an outpatient in the hospital than an inpatient. That just seems so crazy to me.
Well, and that falls under things that are covered and not covered by Medicare. I mean, like I said, your drugs are going to be one of the biggest ones. Think how many diabetics. I mean, every time you get an insulin injection, it's not covered if you're in as an observation patient. So it can get iffy sometimes when you're trying to figure out what do I need to do and what's best for me. It's hard. It's hard. It's hard for us to understand. I mean, I work in healthcare and it's complicated to understand. So I can only imagine what it's like for a senior citizen, that they're getting calls at night and they're promising them the star, sun, and moon, and I have to tell you a little quick funny. So I have always told my dad, do not change your Medicare. You stay on traditional Medicare. You hang up on anybody that calls you. So he got called at like 8:30 one night from a guy from Humana, and he changed his Medicare. I was livid. So I went and got him, and I made him sit in the truck with me. I called the insurance company, and it stayed on the phone like an hour and 45 minutes. And I made him sit in the truck with me while I had this conversation. And I was like, and when I finally got through, I turned around and looked at him and I said, you see how long this took? I said, don't you do this again. And I laughed and I thought, this is like talking to one of my children. But it was just, I was like, do not do this again.
Oh man!
You can quickly see how it's overwhelming to anyone. I mean, we're in healthcare, and it's a bit complicated and overwhelming. But imagine as a senior, and you're retired, and you're trying to figure out what the right decision is, and you've got these folks that are calling you to sell you on something. You have to realize that they're trying. It's a business, right? They're trying to sell you on those things, and to me, as I'm sitting here understanding the information, it seems like if I'm early in my retirement and I don't really have that many health issues, the Advantage plan may be something that fits my lifestyle better. But as I age and things start to slow down and I'm not traveling as much and I'm needing more extended care, I may be able to flip back to traditional, and that will help me through the rest of my life. So that's pretty interesting. But what about wellness? Like I talked to my mother about when she goes to the doctor and get checked up, and she's always like, well, I don't want to have to pay for this, I don't want to pay for that. I'm like, well, it should be part of your annual wellness visits, right? So what does wellness benefits look like between the two plans?
So the number one thing I'll talk about wellness is you go to the doctor and they do a physical exam on you and see you and say, "Oh, you're great. This is your wellness visit." That is not what Medicare considers an annual wellness visit. Um, there's this big long questionnaire. Basically,
Ridiculous.
they have to ask you all of these questions. They have to do depression screenings. They have to do now they have to do opioid and drug abuse screenings.
Hmm.
That is one of the things that's required for, especially if you're on prescription narcotics. They've got to do those screenings. Um, they assess your safety at home. What kind of environment do you live in? They may ask questions such as, do you have guns in the house? Are they
Hmm.
locked up? I mean, it's very in-depth questions that they're supposed to ask you. And it's basically to assess your mental, your physical, and your environmental.
Hmm.
It really is interesting. And so I do have doctors, I tell them all the time, if a patient comes in, you doing a physical exam is not a wellness visit. There's lots of components to that. You even need to be discussing end of life. What do you want for your end of life
Yes.
care? If something happens, your primary care provider should know that. And that's part of your wellness, yearly wellness when you go, is that you're having those discussions with your providers. The other thing we see a lot of times are the labs that are covered under wellness. Um, I see doctors all the time. They order all of these labs. They'll order thyroid testing. They'll order what's called a CMP. It's a chemical in your body, everything. They'll order that. They order all these things, and those are not wellness tests. Wellness tests are screening tests. You're
Hmm.
screening for diabetes. You're
Hmm.
screening for lipid. You're screening for
Yep.
cancer. Those are considered wellness. If you have those diagnoses, okay, so I'm a diabetic. I can't go to the doctor and get a screening diabetics test
Yep.
because I'm already a diabetic. So I can't have that. If you have elevated cholesterol, you can't have a screening lipid test because you already have that diagnosis. And on a lipid test, it's only covered once every 5 years by Medicare. So if
Hmm.
your doctor's ordering one every year, it's not covered. They'll only pay for once every 5 years. Um, Men have PSA exams. So if you're over 50, a PSA exam, Medicare covers that. For females, mammograms, and they'll pay for a mammogram up until I believe you're 70, or it may be 80. But if there's a cap on how long they'll cover a mammogram. PSA is the same way. I think they pretty well much said once you're 70, 75, there's no point in having a PSA any longer as a screening test.
It's interesting, the lipid panel or the lipid test, cholesterol essentially
Hmm.
is what they're looking at there. And cholesterol can be so positively
Hmm.
impacted by changing your lifestyle, changing
Hmm.
your diet, changing your exercise. And so if they do my like lipid panel and find that I have elevated cholesterol and it's high enough that they put me on some drugs for that, but then I decide I'm going to take care of myself and I, lose weight and I start exercise, I start playing pickleball, and I start moving and I don't drink the Red Bull and all of those things. It's, I'm going to have to stay on that medication for 5 years,
No,
unless
you're
I pay for the test myself.
No, because at that point, once you have the diagnosis, it's covered under regular outpatient testing. And
Okay.
so
It's
it
no
would
longer
have,
It becomes
screening.
a
yeah, it's no
therapeutic.
longer a
Okay.
screen.
Got it.
Yeah. Because
So then
yes,
it's
if you,
subject to deductible and co-insurance
yep,
at that point, depending on whether you have Medicare Advantage versus
Hmm.
yes,
traditional Medicare.
yes,
Okay.
yes.
Okay, that's good to know because that was a little nerve-wracking.
No, no.
Um,
Once you get the diagnosis, you can have the test 2, 3 times a year. It's just, you can only be screened once every 5 years.
okay. Fair, fair. That's a good distinction between the two.
Yeah.
I'm glad that you brought that up. It's interesting, these benefits. One of the reasons I did choose the Medicare Advantage plan for my dad a long time ago, again 20 years ago probably, was, or 15, whenever they started, um, was because it had all of those additional benefits.
Mhm.
And when I'm talking about the benefits and wellness there, I'm talking about the things like the drug stuff that came for his maintenance drugs, but then also he did have Humana for a while, and he was on Silver Sneakers, and it was an encouragement. I was like, Dad, you can come work out where I work out because they have a Silver Sneakers program. You just scan your thing every time you go in, and that's how that community center, I think, got paid for his membership. Was if he went 6 times a month, they would send some money to that community center from the health plan, and that kind of thing was covered. He recently had a Cigna Med Advantage plan a couple of years ago, and they sent him I think a $50 or $60 gift card for every quarter that could be used in their CVS or in their store, like their pharmacy, where you can do mail order things. Or there were some like Walgreens or different places around that were local, and you could use that for things like Polygrit for his dentures, or for Tylenol, or for Band-Aids, like anything that was health related, health or wellness related, he could use that for. And I thought that was a great benefit. But then again, at the end, I just decided that it was not a good plan to stay on. So I guess any final thoughts on the wellness component, Lorie?
Just be aware of what wellness really is. Check your Medicare new book and understand what tests are covered under wellness, because we have a lot of providers that will order all of these tests that are not covered under wellness. Well, then the patient will call the hospital and say, you know, this was wellness. It wasn't supposed to cost me anything. Well, really and truly, it's your responsibility to know what's covered and what's not under wellness. And a lot of times hospitals will just adjust those off in those instances, but they really can bill the patient for them because Medicare says you should know what is covered and not covered.
Yeah, absolutely. Seth, any final questions?
No, I want to give Lorie the opportunity to share, like, if folks want more information, how do they reach out?
Yeah, you can reach out to Primo Consulting Group, or you can email me at lmills@primoconsultinggroup.com. We would be happy to come and educate your patients, educate your communities, people that work in your facility. If you want to learn how to do this, and so you can educate people on your own, we'll be happy to come and do some presentations for you guys. I just think it's very important that our patients understand and are able to make an informed decision on what is best for their health needs.
Yeah, absolutely. And Seth, would you mind putting Primo Consulting Group and Lorie's email address in the post when we do this?
Sure. Yeah.
And it's important because choosing a health plan at any age and in any line of business, commercial or Medicare or Medicaid, choosing a plan and providers is incredibly important. And so you really do have to evaluate your current needs, maybe your projected needs as much as you possibly can, against the opportunities of Medicare versus Medicare Advantage, because it is not a one size fits all. And there's upfront cost or back end cost, which one works best for you, and talk with someone. And then in addition to Seth putting the information in for Lorie on the social media post, Lorie has presentations. She has already done this type of education. Her company has already done this type of education. So they're very familiar and they're ready to go. So if you're trying to ramp up in the summer to get align with open enrollment, it's probably a good time to reach out. So Lorie, thank you so much. This is good. And I hope that all of our aging population listens to this just to get a little bit of guidance.
Yep. Thank you guys for having me. I appreciate it.
Absolutely. Shannon, until next time, my friend.
See you next time, buddy.